Welcome to Level Up Your HSA. Pro tips to spend, save, and invest for the future. Here we will discuss how you can spend, save, and invest in your healthcare with a health savings account. HSAs are tax advantaged member owned accounts that let you save pre tax dollars for current and future qualified medical expenses. You can invest in mutual funds tax free, and funds never expire. Combining a health equity health savings account with an HSA qualified health plan delivers incredible benefits. HSAs are the only triple tax advantaged accounts available. They allow you to contribute tax deductible funds, grow tax free earnings, and enjoy tax free distributions to cover qualified medical expenses. We all have different goals we're working towards when building our financial security. You may be saving your HSA funds for unexpected medical bills. You may only be contributing what you need to your HSA to spend on your current medical treatments. Or you might already be investing your HSA funds to use in retirement for your later healthcare needs. Any way you use it, the HSA provides you with tax savings and allows you to provide for your healthcare without worry. Let's introduce you to the Jacobson family, who have goals they are working towards using their HSA. Olivia and Henry, married with 2 kids, are always trying to find ways to save money by spending wisely on their family's medical needs. They want to be smart spenders with their HSA funds. Henry has a specific healthcare expense in the future he's thinking about. We call him a savvy saver. In later years, when Olivia and Henry start to shift their mindset to focus on retirement, as informed investors, they are looking for ways to increase their tax-advantaged retirement investments. Over the past few years, Olivia and Henry have been happy to see that by contributing pre-tax dollars to their HSA, their healthcare dollars stretch further when paying for qualified medical expenses than if they paid for them after tax. Their daughter is a competitive lacrosse player, and their son has an asthma condition, which requires frequent medical care. Olivia always talks to her health plan provider to get the best care for her family. She asks them for in-network care for her son's asthma because she's learned she will save money by choosing those in-network providers for their plan rather than going to out-of-network doctors. She also saves money by researching the medications her son needs and finds the best prices using coupons and rebates for some of them. She also switches to generic drugs when they're available, saving them money. Because her daughter is active in sports, Olivia is always thinking about possible injuries. As she checks online to learn about emergency treatment costs, she learns her health plan has an urgent care center nearby that is generally less expensive than a trip to the emergency room. Like Olivia, you can put small amounts into your HSA that can provide you with a short-term medical emergency fund that you can use for unplanned injuries or medical events. When Olivia's daughter sprained her arm and needed x-rays after a game, they were taken care of at the urgent care center. Olivia avoided paying 5 times more just by knowing where to go. And because Olivia easily checked her HSA balance using the Health Equity mobile app, she knew that they were covered for this incident. You too can save money by avoiding emergency room visits when possible and choosing an in-network urgent care facility. Or if the situation allows, making an appointment for care with one of your in-network physicians. It's important to plan ahead, to call your health plan, and know which facilities to go to when an emergency medical situation happens, so you don't have to pay high costs for emergency room service. In addition to being smart spenders, Olivia and Henry keep a close eye on their budget, and they're focused on saving for future medical expenses. By making tax-deductible contributions to their HSA and letting their funds grow tax-free, they're able to plan for their future health care costs, specifically for Henry's LASIK eye surgery. Wondering how much you can contribute to your HSA? The Internal Revenue Service, IRS, sets the contribution limits each year. Also, HSA members who are age 55 and older can contribute an extra $1,000 each year. And remember that employer contributions are added in as part of your total yearly contribution limit, if applicable. As you contribute your HSA funds, you can use the money to pay for qualified medical expenses for you, your spouse, and dependent children included in your tax return, as long as their expenses are not otherwise reimbursed. Dependents do not have to be on your healthcare plan in order for you to spend your HSA dollars on their healthcare needs. Because of the tax savings on contributions, you can save on qualified medical expenses, including but not limited to the expenses seen here. Check out the most common eligible expenses at healthequity.com/HSA-QME. And to make finding HSA eligible products easier, head over to hsastore.com for guaranteed eligibility on over 2,500 products. Now that you can see how to contribute to your HSA and what you can use it on, let's see how Olivia and Henry continue to be savvy spenders. Henry and Olivia plan for the LASIK surgery by maximizing their yearly family HSA contributions. This year, that means setting aside money for the surgery. Instead of paying for some of their qualified expenses, like their son's asthma medication prescriptions, they decide to pay for those out of pocket instead. Knowing they can reimburse themselves in the future for these expenses if they choose to, they scan their receipts using the Health Equity mobile app. With an HSA, there is no time limit to reimburse yourself for qualified medical expenses that you pay out of pocket for. This means you can accumulate the reimbursable amount until you reach a determined savings goal while building tax-free earnings. With time to plan, Henry looks into a number of clinics for his eye surgery and determines the one that has the most reasonable price. Remember to check your high-deductible health plan for in-network providers and find the most affordable options for your care. When Olivia and Henry reach their savings goal and Henry has his eye surgery, they're able to use the funds from their HSA to pay for it and the follow-up care, making the recovery much easier to handle physically and financially. And the following year, when they've built up their HSA contributions again, they decide to reimburse themselves for some of their previous year's prescriptions. To get reimbursed for eligible previous expenses, they simply log into their account, create a new claim, upload their saved receipts, and get reimbursed for those out-of-pocket payments. Remember that there is no time limit to reimburse yourself for eligible expenses as long as they were incurred while you were covered with a high-deductible health plan. Always save your out-of-pocket receipts and benefit statements, which you can upload to the Health Equity mobile app so that you will have your documentation if you decide to reimburse yourself later on. In later years, when they become empty nesters, Olivia and Henry start to think about their HSA in terms of long-term retirement savings. They log into their account and choose to enroll in automated investing of their amount of funds over the required investment threshold, so that when they reached the required balance, it would automatically be invested to their specified investments. Cash Replenish allows you to invest with your HSA while you still maintain a cash cushion for instant access to eligible medical expenses. Simply decide how much you want to keep in cash. This can be the same amount as your investment threshold, your annual deductible, or a custom amount greater than your investment threshold. If you're new to investing, you will set up cash replenish when you get started in the investment desktop. You can manage this and other automation tools from the investment desktop or the Health Equity mobile app. HSAs are a great way to save now for long-term medical expenses you may have in retirement. If you're nearing retirement, there are some elements to be aware of with your HSA and Medicare. Once you are enrolled in Medicare, you're not eligible to open an HSA, contribute to it, or receive employer contributions. However, you can still spend your existing HSA funds tax-free on qualified medical expenses for you, your spouse, and your tax-qualified dependents. If you, the account holder, are over 65 and you distribute money for expenses other than qualified medical expenses, it is subject to income tax, but no other penalties apply. As long as you are age 65 or older, you can use your HSA to pay for Medicare premiums and out-of-pocket expenses, including deductibles, co-pays, and coinsurance. This applies to Medicare Parts A, B, C, and D. Prescription drug premiums are only valid HSA expenses if they're part of Medicare Part D. If you are younger than your spouse and have not yet turned 65, then you want to make sure to open up and fund a spousal account if you want to use HSA funds to pay for your spouse's Medicare premiums once they are enrolled and turn 65. If you are not 65 years old or older, Medicare premiums for a spouse or dependent are not a qualified medical expense. If you choose to delay Medicare enrollment because you are still working and want to continue contributing to your HSA, you must also wait to collect Social Security retirement benefits. This is because most individuals who are collecting Social Security benefits when they become eligible for Medicare are automatically enrolled into Medicare Part A. You cannot decline Part A while collecting Social Security benefits. The takeaway here is that you should delay Social Security benefits and decline Part A if you wish to continue contributing funds to your HSA. Finally, if you decide to delay enrolling in Medicare, make sure to stop contributing to your HSA at least 6 months before you do plan to enroll in Medicare. This is because when you enroll in Medicare Part A, you receive up to 6 months of retroactive coverage, not going back farther than your initial month of eligibility. If you do not stop HSA contributions at least 6 months before Medicare enrollment, you may incur a tax penalty. If your spouse has turned 65 and is on Medicare, but you are younger than 65 or have delayed Medicare enrollment, you are still able to contribute to a health savings account if you are the account owner. With that being said, we do advise to consult a tax professional for counseling about HSAs and Medicare. Always keep in mind that it's never too early or too late to start thinking about retirement. Starting the year that you turn 55, you can begin to make the $1,000 additional contribution to your HSA and maximize the amount of money that you're saving. And remember, you can invest your HSA funds just like a 401k. You're able to access invested funds anytime if you have medical needs that you need to pay for. You enjoy lower fees and transparent pricing. And you can take advantage of powerful advisory tools that Health Equity offers. If you are close to retirement and just now discovering the usefulness of an HSA combined with a retirement plan, know that there is still time for you to take advantage of the benefits that come from using your HSA as another retirement vehicle. Here is an example of a married couple who want to take advantage of an HSA and the 55 and over catch-up contribution. Roger and Noel are both over 55 and employed at companies who offer high deductible health plans and HSAs. They could each decide to open individual HSAs and contribute the individual contribution amount plus the $1,000 catch-up amount. Both spouses must have individual HSAs in order to each contribute the additional catch-up amount. However, let's say that only Roger or Noel decide to open a family account, then they could contribute up to the family maximum contribution amount and then the $1,000 catch up amount for the HSA account owner only. So, if you would really like to maximize the catch up contribution, then you both must have your own individual HSAs. An additional element to remember when you open your HSA is to designate a beneficiary to whom any funds still in the account should go to upon your death. You can name a spouse, children, other individuals, or a trust as the beneficiary of your HSA. If your beneficiary is your spouse, then your HSA upon death becomes your spouse's HSA. The surviving spouse can continue to access HSA funds, and distributions for qualified medical expenses will be tax-free, the same way they would be if distributed by the previous account owner. Beneficiaries other than a surviving spouse must include the full value of the HSA as taxable income in the year in which the account owner passes. To designate a beneficiary, log into your account. Under the Manage Account menu options, select Beneficiaries and follow the steps on the screen to select your beneficiary. Health Equity makes saving, spending, or investing your HSA easy with our 24/7 member services availability. Easy access to the mobile app, convenient payment and reimbursement, and simple investing from the investment desktop or Health Equity mobile app. You can manage your investment account and HSA account for your eligible expenses within the mobile app. It's easy to submit a claim, check balances, and add documents to your account within the app. You can also use the barcode scanner to determine eligible items for purchase with your funds. And remember, you can find more information on our Learn site, and our member services team is available 24/7, 365 days a year to take your calls and respond to any questions that you have about your Health Equity account. Thank you for watching.